looking forward to hearing some of the lived experience stories, and yeah, this will be good. Good way to finish today. Hopefully it's been a big day, so I mean, really appreciate everyone that it's been great to get to hear, so looking forward to it.
Okay. Well, good afternoon, everyone, and welcome to session 3 of the webinar. We have a panel of guest speakers who have very kindly banked their energy spoons to be able to contribute to the lived experience discussion today. So I'd like to introduce all of you just to describe a little bit about yourself and your ME journey. So I'll start with Carla. Hi, Carla.
Hi.
Carla has been living with severe ME for 10 years and is housebound. She is passionate about supporting others with ME and does so by performing administrative roles for various Facebook groups for people engaging in ME advocacy, artistic pursuits, and applying for the disability support pension and superannuation insurance. So welcome, Carla. Next we have Sandra. Hello, Sandra. Sandra experienced a sudden onset of ME after contracting a viral infection in November 2012. She is a professional, but was active and fit 48-year-old who became very sick very quickly, and she has not been able to return to full-time work since. After 6 months of convalescence, she tried to get back on the horse and attempted part-time work, which involved trying to do 12 hours per week for a couple of years, but ultimately this too became unsustainable. Sandra was successful in applying for and receiving the disability support pension. However, she was no longer able to afford her life in Sydney and has since moved to the Central Coast in 2015. With a proper diagnosis of ME and understanding that her illness is ME and not post-viral fatigue or chronic fatigue syndrome, and through educating herself, Sandra has been able to prevent further health decline by avoiding PEM to maintain a baseline of moderate ME. This requires being 85% homebound and living a life small in her local area. Sandra does enjoy riding her mobility scooter around the waterways and uses some of her spoon energy allocation towards advocacy. She wants to help others avoid the traps she fell into and hopes to see medical education rolled out and the establishment of appropriate and adequate patient support systems. Now, Bronwyn. Hi, Bronwyn. Bronwyn is 48, who was diagnosed with ME/CFS when she was 26. Over the initial first 5 years, Bronwyn was able to return to around 95% function, but in 2009, after a couple of very active years, Bronwyn relapsed. This meant giving up her work as a brewer in 2013, and Bronwyn has since been living with a severe form of ME since 2016. She is 95% bedbound and in a long, slow health decline. But with NDIS support for the past 3 years, Bronwyn is able to now leave her house on her own 1 to 2 times per month for a few hours. So welcome, Bronwyn. Next, we have Mim. Hi, Mim. Mim's study and work commitments came to a halt when her ME became severe. Now, Mim's days are spent in bed, managing her healthcare needs and NDIS supports. On her best days, she enjoys making art and having bedside visitors. Mim describes herself as someone who likes dreaming, and she values the collective power of community. Jared. Hello, Jared. Jared was physically fit and participated in high-intensity sports before he contracted a viral illness. He shifted from living a great life to, in the beginning, experiencing a fatigue that lasted most of the day. He is a husband and a father who had to take early retirement when his ME symptoms made work unmanageable. Jared relies on his wife as a primary supporter and belongs to the Fibromyalgia ME/CFS group, who meet a few times per month. And finally, Chris. Hi, Chris. Chris is 57 years old and has been living with ME for 3 years now. His symptomatology is classified as moderate. Chris is still able to work, managing 2 part-time jobs, working mostly from home. Chris is lucky in that his employers have enabled him to continue his long-standing career as an expert working in social policy, advocacy, research, and has secured some big project funding with good outcomes. Chris knows he often does more than he should. However, he is not sick enough to receive or be entitled to any support. However, Chris reports with each crash, his recovery is slower and he returns to a lower base level. Prior to his illness, Chris was very fit and healthy, considered an elite athlete for his age, having won 8 state surfing titles and numerous marathon ocean paddling events. Giving up on competing and pursuing the things that Chris enjoys has been the hardest thing to do, as is learning through trial and error to manage the widespread effects ME has on his body. Okay, so that's our panel. And the way this is going to work is I'm just going to start off with a talking point, and then anyone who would like to contribute, please feel free. So first of all, who would like to speak to navigating the journey to diagnosis? Sandra?
Yep, I'll have a go. I'm just trying to multitask here. It's quite tricky. Thank you for that lovely introduction, and today's been really amazing. I've been really heartened by the presentations and so happy to have this forum, and appreciate the patients being here too. Big empathy for everybody. I'll show you what I've done. I create mind maps. I don't know if you can see that, only because I can't get my thoughts in order to write anything logically. So I've got some points here to jog my memory on what to talk about. So firstly, I was very lucky, I think, compared to many patients that I've heard about, is in that I was a natural health practitioner when I became ill. So I had access to a lot of medicine outside of the box. And initially the virus made me have a seizure. So I had a hospital episode, and my original doctor dismissed me and said, you know, you've just had the flu, you'll get better in 6 weeks. But I knew I was much, much sicker. Something was really dramatically wrong with me. So I followed up with a more holistic GP, which I'd recently been seeing for perimenopausal discomfort. I find that an interesting link for some women too with our endocrine systems. So luckily, it was about maybe within the first 2 months, I saw this wonderful doctor, and she recognised I was very ill and cared for me greatly with supplements, holistically, with all the regular GP testing, mostly compassion. And she was a godsend, because I don't think I would be moderate now if I didn't have that in the beginning. And in fact, I've had that verified by an ME specialist GP later. So I'm very grateful for her help. However, she was not an ME specialist and did not give me diagnosis of ME initially. I actually believe that it shouldn't take 6 months to have an ME diagnosis, and it's important that it's sooner, because a lot of damage can be done in that 6 months, and preemptive care could take place. There's a bit of documentation on that. I can provide some books and links later that could go into after information. Anyway, the first label I was given was post-viral fatigue, and that's really wrong, and I didn't realize it at the time, but I've actually had chickenpox when I was about 29, and I had post-viral fatigue then for about 6 months, from which I recovered. It was what I was experiencing with ME was nothing like it. This was like a match compared to an atomic bomb. So post-viral fatigue needs to be lost. That's not what we're experiencing. Then, because she's a holistic GP, we went down the adrenal fatigue path, and she did a lot of supplement support for that. She did advise me that I was better off resting, like, you know, for a year. I would have a better outcome, but didn't explain why. So I had an opportunity to go back to part-time work, very low-key work in a bookshop, and only 12 hours a week. And they were very supportive. I wouldn't have been able to do a regular job at all. But I did that mostly because I was losing my identity, and a lot of that was spoken to earlier, which was great. And I also had a mortgage to service. I was trying very hard to, you know, not sink. And I didn't know what damage I was doing. Anyway, it was probably about 2.5 years into it before my GP deemed that I might be well enough to attend a fatigue clinic. So she asked me if I'd like to try a fatigue clinic. I don't know anything about the controversy with graded exercise therapy or any of these labels of chronic fatigue or ME. I didn't know anything about that at the time. And I went, and I must say I did learn very, very important strategies for pacing. That was a really interesting thing from the fatigue clinic at Randwick. However, the overall ideology of it is the graded exercise therapy, although you get back on the horse, you get back to work. So it did not teach me. They gave me a label of chronic fatigue syndrome. And I was really excited that I had this name. I went back to my doctor and said, oh, I've got CFS. Now I know what I can deal with. She just kind of looked at me like, trying not to label anything, just working with symptoms, which was kind, but still didn't help me a lot in identifying that I actually had ME. So that sort of rolled on for a bit, and as I did the program, I really thought I could increase my activity and get better and all this sort of stuff. I still had no idea I was never going to get better, and I ended up getting sicker, and I ended up losing my job, my part-time job. Then that created a move, so I had to move from Sydney to the Central Coast, where I could afford housing here. And so I'm losing my track of thought already. So I'll just check my notes.
That's okay.
Thank you.
If you do you want to say any more, or did someone else want to?
Yeah, that's okay. So actually, I moved here and I declined. The move took me about 2 years or more just to recover from the move to my baseline. And I was really scared of declining because I didn't have any support to look after me should I become bedridden. And my GP then referred me to a wonderful doctor, Dr. Mark Donohoe, and he knows what's going on. He said to me, Sandra, you have ME, you have ME, you have ME, and opposed to CFS. And once I understood what I had and I started learning about it, because I had very little capacity to read then, I really had to rely on doctors advising me. And once I understood what ME was and the post-exertional malaise component, the exercise or the exertion intolerance, then started to stop declining very slowly, all of this, and then slowly stabilize, and even more recently improve my baseline. And that's been a lot with LDN, actually. So if I had known that initially, I'm sure I never would have got this sick. You know, it was just a really long trip. It was about 6 years before that actually happened. And I'm 12 years into it now. So I think that sort of sums up my diagnosis journey. I'm sorry I got a bit waffly there.
That's okay.
So I'll hand over to the next wonderful patient.
No apologies. I think Chris might like to now contribute.
Yeah, look, I'm happy to. Also, if any of the others want to talk first, I'm happy to wait because I can probably hang on a bit longer. And but a lot of what Sandra said really resonated with me, and like I feel I've been really lucky as well in terms of, you know, it took me a year, 18 months to get some sort of a diagnosis. It certainly took a year before I actually discovered ME and I was able to find the consensus criteria. But I was really fortunate because, you know, I work as a academic, so I actually kind of had access to, and I could go and find research. But of course, when you're sick, you can't actually dig through that and can't interpret it and so on, and particularly when you've got a brain fog. So that's really tricky. I was lucky in finding a good doctor who, you know, we worked together on it. In a lot of ways, I was finding a lot of stuff and passing it to her to then kind of, you know, help me interpret and understand. And she'd gone through an experience with her daughter having, you know, post-viral fatigue and going through that. Ironically, one of the problems then was she actually got long COVID. So I then have had to go and find another doctor, which has been, you know, really sad and difficult. But the other thing Sandra was saying that I could really kind of sympathise with is that you find out bits and pieces along the way, but it's really hard to get the good advice. And so there was stuff I did along the way where I made myself a lot sicker. And, you know, I've been very fortunate in, like, I was owed long service leave, so I was able to take off 3 months and spend that time in bed to kind of be able to recover. But, you know, I then, you know, I also, and like discovering stuff around naltrexone's really kind of helped me to manage the crashing. But at the same time, I've had times where I thought, oh, you know, I can kind of push through a bit, and yes, I'll get sick, but then I'll get better. And so I had a couple of years ago, I couldn't help myself, and I wanted to compete in the state surfing titles, and I went and did that, thinking it'd be worth it to go and do it. And yeah, I'll be in bed for a couple of weeks. And 3 months later, I still wasn't back to where I was. And so I guess that was kind of one thing. But I suppose the other thing I wanted to kind of highlight is it's a long and evolving and ever-changing journey. And you spend a lot of time both learning to listen to your body, but also educating how you understand about how you're feeling. And each time you think you've got your head around it, it evolves and something else happens. And so I've developed all of these allergies and chemical sensitivities. I've gone through a long thing with diet testing. I've had to go off lactose and gluten and a whole pile of other things. The stuff around the allergic rhinitis, because I thought, like, I've had my worst hay fever time ever this season, and none of the drugs that I was taking seemed to be working anymore. So yeah, I can sort of really sympathize for what you've been going through. Like, I also acknowledge that, you know, in a lot of ways I've been really lucky in terms of my my symptoms haven't been as severe. I've been really lucky in that I've kind of had some understanding employers who've kept me on despite the fact that at times I haven't been able to work at all. And kind of what I do is I work from home, and when my brain's working, I focus on the stuff that's going to make the biggest difference. So doing some important projects, getting some big funding up for other people to do stuff. But I've been able to do that because I've got a couple of decades behind me. If I'd been younger and earlier in my career, I would have been stuffed, you know. And I'm at a point now as well where I know I need to cut back more. I'm going to have to let something go. Like I've got kind of two roles and titles. I'm leader of policy and research for the WA Council of Social Service, and I've also been working as a research for Bankwest Curtin Economic Centre. So I've just doing a report on child poverty, and I've just done one on disability employment outcomes, and that stuff, like being able to use my brain, has been really central to my identity. But when it hits and your brain goes away from you, there's nothing you can do. So yeah, I'm at that point now where I'm looking at cutting back again because the crashes get longer and harder, and even with naltrexone and stuff to help manage them, yeah, it's just a really tricky journey. But hand back over to you guys.
Okay. Did anyone else want to describe their diagnosis journey or another topic that they wanted to talk about? Things that I wish I'd known, I think, is quite a central theme as well. Yeah, Carla?
Yeah, I'd like to echo what Sandra and Chris said. I actually was quite lucky that I received a diagnosis fairly quickly, but my doctor told me that GET was the gold standard of treatment. So I was pushing myself so hard. My work was demanding that I wouldn't miss any days, and I was ever since I got ME, I've had sleep reversals. So I was basically going to work about 7 a.m. and then sleeping and then staying up all night because I couldn't sleep normal hours. And then I was having micro sleeps on the drive home on the expressway going 100 k's an hour and stuff like that. So I'd like to say to any practitioners watching that aggressive rest is basically the only chance. It's not a guarantee, but it's the only chance for people to avoid severe ME when they're first experiencing symptoms. And I believe if I'd been allowed to rest and hadn't done GET, then I wouldn't be as severe as I am now. That's all from me.
Yeah. Anyone else? Hi, Mim. Yep.
I'll just add quickly a point about my diagnostic journey. Mine took about 7 to 8 years. And throughout that time, it wasn't linear. Some years I was mild, some I was moderate, some I was severe. One of them I was bedbound. On good years, I managed to work and study part-time. And then at my worst, I was flat-bound. So in bed, flat all the time. I had to eat all meals flat, everything flat. No opportunity to seek medical care outside the house. And throughout these 8 years, I presented to numerous doctors. You know, I'm university educated. I knew how to look at research. So I tried to figure out what was wrong with me, and I came across ME, of course. And I brought the diagnostic criteria to my doctor and said, I've had an aha moment. I've found this diagnostic criteria. This fits my symptoms to a T. And my doctor said, it's impossible because you don't have raised inflammatory markers, which it has never been part of the diagnostic criteria. So I thought, well, she's said this to me with such conviction, I should put it out of my mind. And then some years went on and I came back to my doctor and I said, look, I really think I do have ME. And she said, no, it's impossible. You fit the description for depression perfectly. It's really important that you don't give in to your symptoms and that you push through your symptoms to exercise to avoid deconditioning. Don't spend time in bed. Always get out of bed and stay out of bed all day, or you're just going to give in to your depression. Anyway, so this was my experience over 7 to 8 years. So I unfortunately, now that I'm severe and bedbound, I don't fluctuate anymore quite so much. So I think I'm kind of in this situation permanently now. But there were so many opportunities for medical intervention. And yeah, it's a shame that none of them resulted in any answers. Yeah, and fortunately my family rallied around me, supported me, housed me, cared for me, and that allowed me I needed that foundational housing stability and carers every day in order to then seek medical care. So that kind of foundational support and foundational human needs had to happen first. And then I was finally able to seek private doctors because the public system, in my experience, could not help. So I had to seek very expensive private doctors, specialists, and private allied health. And then I began to receive answers. Yeah.
That is such an experience that you've been through. Taking the advice that was given to you, albeit not the right advice. And what resonates for me is when you've said, I was too sick to seek medical help. Like that just amazes me, and I think really demonstrates how important it is to spread information about ME so people do get it right.
Absolutely.
Thanks, Mim. Bronwyn or Jared, did you want to say something?
Look, I had a similar experience to everybody with getting a diagnosis, so I don't have anything different to add there, except that what I look forward to is a time when, through virtual reality, we could have doctors experience what we're actually experiencing. I could see that could happen. I think they wouldn't last very long with it, and that maybe we'd get some answers, and we certainly wouldn't be having things where they go, oh, you're depressed, or you do this, or you do that, or they may come up with, instead of going, it's all in your mind or your head, it is actually in our brains, and we may actually get some answers then, but that I mightn't live long enough to see that.
Well, hopefully those researchers keep at it.
Yeah.
Yeah.
It would be good.
How about you, Bronwyn?
I had a fairly unusual path, and again, I was incredibly lucky. My mother's a nurse, and she happened to know the leading chronic fatigue syndrome doctor in New Zealand, where I'm from. So I also had at the time I was relatively young, who said, well, you've got post-viral fatigue syndrome. If you're not careful and you don't take it really seriously, you can develop CFS. So I got great advice, and a lot of the advice that I was given worked really well for me, and it meant I could work for another decade before I relapsed. It also is a highlight of, you think you're the expert on your own body and your illness, but sometimes you're just not. Things change. And I also think because it's typically long-term, your body is also aging, your life is changing, the weather's changing, your hormones are changing, even for men, and your muscle mass changes. And the reality is, I think everyone who has ME/CFS, especially when it's sort of a high, severe, moderate, severe, that kind of end, they're like overwhelmed just dealing with this. So all the other things that happen feel like unfair and punishment, but the reality is the really is change. So yeah, I was lucky, and I had an incredibly supportive employer and family and so on. And, you know, it didn't stop me becoming severe. So You can have all the right advice and it will absolutely make a difference in the beginning. It absolutely will. But it doesn't necessarily mean that you won't be suffering for the rest of your life. And that's where the research comes in. But I feel like this comment of being too sick to seek medical help is not actually because we're too sick. It's because it's so difficult to find the medical help. So if it was mainstream, if it was not necessarily the mechanisms well understood, but the management principles and the pervading climate of exercise is really great no matter what. And I mean, even me going in 26, I was as fit as I'd ever been. You just don't assume the exercise isn't your friend. This is 23 years ago. So we're still at that point where most people will say, these are the good things that I do for myself. I should keep doing them, because when it's quite obvious they're not good for you, you still have this very strong automatic mechanism saying, no, that was the good thing you did for yourself today. You're 26, you're this age, of course you can, of course this is good for you. But if a health professional said to you, the only way you're going to know how much better you can get is to take a year off work, and I realise that costs about $100,000, but that is what you've actually got to commit to, then maybe we'd all go right, and our families would go right, and our medical people would go right, and we'd all try and do that. I also think it's really important for the entire general public, especially with COVID now, to know about income protection and total and permanent disability insurance. That's what they're there for. None of us know that until it's too late, and we're not covered as well as we should be.
Thank you, Bronwyn, for those thoughts. Did you want to say something, Sandra?
You're muted, Sandra.
Sorry. At year 6, when I saw Dr. Donohoe, he did broach the concept of trying LDN with me, but I was too sick then to entertain trying something new. I couldn't, it's possible I could go backwards, and I had nowhere backwards to go to. So I said no to it at that time. And it was only about just a bit over a year ago that my current GP brought it up again, and I said, look, I feel stable enough to try, but I wish I had have tried sooner, because it's really helped. And the only thing is that there's, from what I can see on the support groups and my own experiences, very few doctors out there that know how to prescribe it, and how an ME patient really needs to start low, go slow, and titrate up. And, some people are okay on 1 milligram. They don't have to do the 4.1. So there needs to be a lot of education on that, because at the moment we're playing like we're guinea pigs. Yeah, but it is a good thing I've found for myself. I'm very grateful for it. I wouldn't be here today without it, I don't think.
Yeah.
Thank you.
I think that's a general theme of trial and error and not knowing, and being comfortable with uncertainty. Like, it's, really, that's what I hear a lot, is that it's hard to get a definitive answer or information that everyone agrees on. There's lots of conflicting information out there, and what's the right one? As we're living in an age where we can access so much information, it's really, really difficult to know who to trust, what to trust. So where do you get your information? Chris? Yep.
Yeah, well, I was just going to follow, like I had similar experience with Sandra, and I was sharing some stuff around low-dose naltrexone on the chat earlier. Yes, it was a long journey to be able to get on it. I managed to get onto the kind of research program with NCNED, but then I had to find a doctor that would prescribe it to me, and I had a lot of backwards and forwards to kind of, communicating between them to convince them to get over. And it did take me a long time. Like I'm on 3 milligrams. It took me a long time. I was doing 0.5 every fortnight, which I think was what Sandra said that she did. And, you know, I did that by getting lots of different size ones and mixing them up. And at one point, I was trying to step up 0.5 and I'd run out of the 0.5s and I tried it going up 1 milligram. And I just had the worst side effects. I was just full of pain. I had blinding headaches, aches everywhere and so on. And that kind of almost put me off. You know, I dropped back for a while and then kind of did it again slowly. But then when I got up to 3 and felt I was stable, I wasn't inclined to try much more. I'm wondering about considering whether I need to do that some more and going into the future. One of the things I'm looking at is whether I shift to taking it in the morning because my sleep's really bad. And I'm very bad in the mornings. I wake up not feeling refreshed. It takes me a long time before my brain starts working. I mean, I also run out of energy halfway through the afternoon as well. And most nights I'm in bed at 7 or 7:30 sort of thing. But I was thinking of trying, yeah. So that's something I'm looking to in the future anyway. Talking to the other thing I wanted to say, the thing I think that's been really important has been the voice of lived experience. So, you know, I really appreciated the session that Brianna was doing this morning about talking about how, you know, you get consumer engagement in. And for me, being able to get support through like Emerge, talking to the nurse practitioner there, who's someone who's both got medical knowledge and experience, it has been kind of really important. And certainly a lot of the stories I've heard, and I'll hand over to Bronwyn now, you know, people have had similar experiences and there's also advice that, you know, in the longer term, perhaps it stops working and you may need to be resting a day a week. But again, it's one of those things that you balance up and you're going, can I risk being bad tomorrow? I think you're still muted, Bronwyn. I'll hand over to you now.
I don't remember raising my hand twice. Right, so LDN, I'm very lucky in that I'm not particularly sensitive to medications, so I don't have, well, not yet, quite wild reactions. So I tend to actually need very high levels of anything for anything to work, and that includes normal medications that aren't related to ME/CFS. So I've done LDN. I was able to go up 0.5 milligram a week up to 4.55. Get me a hangover when I was taking melatonin, so I stopped taking that, and that went away. And it also, the only thing it really did for me was improve my sleep a little. Other than that, no real changes. So I went up to 6, no dramas, did that, went up to 9, no dramas, did that, went up to 12, no dramas, did that, got really expensive, wasn't making any difference, came off it. And I'm about to do the very low dose, like the 0.1, 0.2 next. And then after that, I'm going to try that 3-hour protocol of, say, 5 to 7 milligrams every 3 hours. The concept of doing that for me, especially when you've got a solution that needs to be refrigerated and you've got to go back and forward and all of this, takes me months to sort of set something like that up. But I'm taking other medications 5 times a day, so I think I can make it work. I just have to give myself a good 3-month lead time to come to terms with the daily and commit, basically. So yeah, and most people I know who've tried LDN, it may have given them a small amount of relief for 1 or 2 symptoms, but I have met very few people that it's really changed the severity of their illness to the point where they say, you know, their quality of life is significantly different. And I don't think I've met anyone who's basically recovered. So I wonder whether that may be maybe it's more effective in the early stages of the illness, because most of the people I know have had it for quite a long time. Yeah.
Mim, did you want to say something? You've got double hands up and we can't hear. Yeah, got you.
Yeah, just 2 things. Quickly, I just wanted to mention that I've had the biggest improvement I've had is from low-dose aripiprazole. There's a small retrospective study on it that came out of Stanford, but it took me 1.5 years to find someone willing to prescribe it. I went to 4 different specialists and integrative GPs who said no. Finally, I found a supportive neurologist who agreed to prescribe it, which I'm very thankful for because that has given me the biggest improvement in my health. And without it, there is no way I would even be able to watch this video today. So, yeah, that's the biggest improvement I've had. And also intravenous fluids, which are its own kettle of fish, but very helpful for me. One thing that I wish I'd known is I wish I'd known that I could use mobility aids to increase my independence. And
that's an IT thing.
And, you know, throughout my very long health decline, I made a lot of comments to doctors and allied health practitioners about my mobility decline. At one point, I said to my GP who diagnosed me with ME, I went in and I said, look, I can't walk over telehealth. I said, look, I can't walk to the toilet anymore. I crawl for a meter and then I lie down and take some deep breaths, and then I crawl for a meter and I lie down, take some deep breaths, and then I get to the toilet. And this is taking up my entire life and I can't do anything else. And there was no mention of a mobility aid at that point. So I think that would have been a great moment to say, look, you need a wheelchair. But it wasn't on my radar yet. I also went to allied health practitioners and said, look, I need a disability parking permit. I can barely walk into the shops. I'm having a lot of difficulty. And again, there was never ever any mention of a mobility aid. It was actually the chronic illness and disabled community online who said, get yourself some mobility aids. It's going to change your life. And that's when I went out and purchased one. And unfortunately, it was too little too late because I was already bedbound. But it would have been wonderful to have that suggestion earlier on. And yeah, I just want to say for anyone watching, you know, if you're having trouble getting from A to B, whatever your A to B looks like, whether it's from the bed to the toilet or your home to your workplace, if it is difficult, it's worth looking into whether a mobility aid could help.
All right, Sandra, Carla and Jared all have things to say, but off you go, Sandra.
Thank you. Thanks, Mim. That is a very accurate description. My GP, even fairly recently, it's only about 3 years ago that I got a mobility scooter, wasn't keen on me having it. She was more worried about my cardiovascular health and getting me to walk a bit more. I just ignored her basically, and I ended up with a scooter because I have a neighbour who's disabled. He had a stroke, tried his scooter, and I went, I need one of these. And had to pay for it myself. I can't do that again if it breaks down or something. I'm not cashed up enough to do that. But it gets me shopping. It's gets me out, stops me from going crazy with cabin fever. I love my scooter and it's been life-changing, and I use it so that I can have energy to do other things that I need to do, like maybe cook a meal. Yeah, so yeah, absolutely. Doctors and OTs, physios need to understand that we work differently to the regular client.
Yeah. Yep, keep going. Yep.
Before I forget, I just wanted to say about ME symptoms. Very few are ever talked about now. I get about 4 of the core symptoms, and seriously, there's like over 30 that I'm aware of. I'll just hold this up. Can you see that?
No.
Not terribly clearly.
Okay.
Is it
from Jodie Bassett, who's an Australian woman? She's passed away from severe ME, but she had a foundation called Hummingbirds Foundation, and there still is web access to her materials. And her description of ME symptomology is the most comprehensive one I've ever seen. sore throats, chills, sweats, low body temperature, low grade fever, lymphadenopathy, don't know how to pronounce it, muscle weakness or paralysis, pain, spasms, loss, nausea, vomiting, vertigo, cardiac arrhythmia, orthostatic intolerance, goes on. All of these things happen to us and we don't know what's going on. We think we're dying. And you go to a doctor and they don't know either. And until I had this list, I didn't have a name to describe what I was experiencing. So we need to expand the idea of what this symptomology is, because it's truly, like in the past, it was known to be much more than what we're talking about now.
Well, the nature of the disease is that it doesn't untouch any body system. So virtually everything can go wrong. Nothing's out of reach.
I found a link for that and I put it in the chat. I
Great.
also found a link for aripiprazole because I'd never heard of that, and I'm really grateful to hear that. Thanks, Smith.
Yeah. Carla, would you like to say something?
Yeah. But first I'd just say be careful about aripiprazole. I can't pronounce it. There's only a small study that some people have had benefit, and there's a lot of other people who have had negative side effects. So you do need to make sure it's tailored to you, and I guess consult with your doctor as always. But yeah, definitely research online about it before you take it. What I wanted to say, Nicole, your question about where'd you get your information from, and a lot of it for me is from Facebook groups, from patient experts who have dedicated their lives to learning and helping others. Every time a friend or connection on Facebook gets prescribed LDN, I always emphasize joining the LDN group, because as people have said, you have to start really low and go really slow. And then there's Ray's presentation mentioned transvagal nerve stimulation. There's a group for that, and I've dedicated like 6 years to DSP and superannuation insurance. I just can't cope with seeing my fellow patients suffering and struggling, and it's just devastating to see it. So it's something that I can do to feel like I have some meaning in my life, since I am housebound, and we all just have to help each other, because I know the research is changing now, but up until now it's we've been so maligned in this community, and the only knowledge we've had is from each other. That's all from me.
Thank you, Carla. There is a really strong power of social connectedness that's only enabled online, and I completely agree that it's you guys that's working out and putting the pieces of the puzzles together. The medical industry is doing what it can, but I think that self-directed learning from each other has proven to be the most beneficial for you at the moment. Jared, did you want to say something?
I was just wanting to talk about things that I wish I had have known. And there is a number, as we all have. The one thing though is I wish I had have known exactly how much this would change my life, and that basically from the 28th of April 2013, which is when I first was bitten by a mosquito, that my life, I wouldn't say that it stopped, but every part of my life changed. We had friends that just drop away, not from, they just get sick of asking and you saying no, that you're too sick or whatever. The fact that financially there's an impact in terms of not being able to work anymore. I worked for a number of years, but I no longer can do that. but also that you go down a rabbit hole of trying so many different treatments, generally that are expensive. At this point in time, none of them have worked. And in retrospect, you try things that are quite insane, but you are so desperate for looking for a cure. The other thing that I wish I had have known, that PEM didn't relate to necessary, or absolutely in my case, doesn't relate just to exercise. I am still able to exercise. I do that on muscle memory. My exercise, sometimes when I come back home, I don't really remember a lot of it, but I can look and I know that I've done it. But if I go something like this, I find exhausting. I can no longer read a book for very long. If I go and have coffee with a few friends, that exhausts me. Shops, lights, any of that background noise, they're the triggers for me. Whereas the whole thing, when my doctors were first talking about chronic fatigue syndrome, I related that to just physical exertion. So I wish that I had have known that it was multifaceted, and that, you know, that there was a cost. And if I had have known that, certainly about 18 months out, or 2 years after I first got sick, I actually went back to work full time. And that lasted for 18 months. And in the case of one incredibly busy week, that is what has actually triggered what that has made me worse, to the point where I had to give up work, and I've never been able to go back to it. So I think, and then of course people don't understand. The word chronic fatigue syndrome was dreadful, I think, in that I read something recently that if you ask people in the general population, 25% of them will say that they're tired or fatigued. And that's not anything against them. They just don't understand the level of what we talk about when we talk about being unwell. So that was all.
Yes, thanks, Jared. And the triggers are different too.
Absolutely. Everybody has a different trigger.
Yeah, yeah. Everyone wants to say something. Who wants to go first? You're at the top, Chris. You go. Yep.
Look, I thought Jared's point there was a really good one about it's not just physical, and particularly with your experience with work, because I've increasingly become aware of two things, and one is both how difficult the disease makes regulating your emotions, and how sensitive you are to emotional conflict and emotional work, really. And for me, the thing that kills me is facilitating meetings where I'm trying to think in my head what everybody's thinking and doing. You know, if I go and have to facilitate a meeting for a couple of hours, I'm dead afterwards. It just knocks me out. And similarly, because in my work, I've actually done a lot of work doing advocacy for services around child sexual abuse. I worked for a while on the Royal Commission team and so on. And dealing with that stuff and talking to people and, you know, experiencing their kind of trauma secondhand, for me, that's the stuff that can really kind of set me off more than the emotional stuff.
Thank you.
Thanks, Chris. Bronwyn, did you want to say something?
Yeah, two things. So my symptomology is extremely aerobic, but very early on I realised that any kind of emotional peak, whether it was a negative one or a positive one, cost me. So very early on, thankfully for recognising that, I decided I can't be bothered with the negative ones because I don't even enjoy them. So I've become quite pathological in my ability to be able to let things go that I have no control over. And I find, because I've been in the community for such a long time, I really feel bad for people who can't do that. And I also wonder whether maybe those kind of emotions don't cost them as much. Maybe they have something that they get out of it, like a feeling of power or control. It doesn't give me that, so I don't but also the irony of having to regulate how happy you get and how excited you get. It seems a bit, well, that's pretty mean, I reckon, of life. And the second thing is I think if I part for 3 years before I had to give it away, and I think if I'd had a scooter at work, because it was a very, I walked long distances and did a lot of steps and things, I don't think I would have had the small enough ego and low enough pride ratio, or, you know, like barrier to actually do it. But if a doctor had said, this is actually something that will keep you working longer, I then probably would have said to all my friends at work, this is something that will keep me working longer. We all would have been okay. And I think that really could have, I may not have got as severe, but I probably could have earned more and for longer, which would have been wonderful. I think there's a real stigma against that, not even just in society, but in ourselves. And when I first got my wheelchair and I put a picture of me going to the art gallery, the people who I had known in Brisbane, because I was in Adelaide at that time, all went, oh my God, what's happened? They thought I was dying and I had cancer. I'm like, no, it just means I can leave the house and do something, obviously with someone else pushing. But I think that kind of stuff is quite important to make it sort of more normalised and more accessible. The wheelchair was secondhand, like $110. It was life-changing.
Yes. Thank you, Bronwyn. Did you want to say anything, Gerard?
Sorry, I'm mute. No, I admire you for being, Bronwyn, for being able to keep your emotions in check. That is certainly one of the problems that I have. To the point where often with its family members, my wife, family problems, my wife will actually deal with them with our children. Not that I don't want to, not that I don't love my children, but my responses probably aren't always the absolute best. I find that I have to be careful not to go from 0 to 100 in a second. Yeah.
You're muted, Nicole.
Oh, I was just going to say, so you generally have a lower tolerance threshold for things.
Oh, absolutely.
Yeah.
It's I don't know what 0 looks like, but it's pretty close.
And it's so cruel to think that you have to force yourself to stop doing something that you are enjoying doing, like
Absolutely.
reading or something like that, because you know what lies ahead if you don't.
If you don't, yeah. I used to basically devour books. So I would sit up all night to read a book. Sometimes I get them from the library now and I can't even be bothered to start them because yeah, I know that, you know, I've read the same page 20 times.
Yeah.
So it's all part of it.
Yeah.
But it's it doesn't make it any easier.
Mim, did you want to say something?
Yes. So this is perhaps a slight tangent from pacing, but related. And it's a bit of a taboo topic, but I believe that conversations around volunteer-assisted dying should take place for those most severely affected by ME. I think if an individual finds themselves for any reason in a place of utterly unbearable, relentless suffering, then I think it's really important to open up these conversations. And obviously it's deeply personal. No one except the individual suffering can make that call. But I think that we need to be talking about it for the subset of individuals with ME, because being in bed, unable to think, speak, eat, or toilet without crashing is a devastating way to live. And we shouldn't assume that people can put up with that for the rest of their lives.
And who would you think would be the best person to broach that, Mim, in your opinion?
Perhaps a healthcare team. I think a doctor, a GP, and it depends on the individual. I'm very fortunate to have supportive family, so I think it would need to be a family conversation, but definitely overseen by a health professional.
Yeah. Yep. Okay. Thanks. Bronwyn? Bronwyn?
Yes. Oh, I remember now. Oh, absolutely. And I find conversations like that not particularly confronting, but I know other people really do.
Right.
For
Yeah.
me, the option of having it out was actually like a life-changing situation where I thought, okay, well, sorry, if it gets bad enough, I know what I need to do, and the people around me support that. My biggest fear is not being able to take care of that myself, because you can't ask family and friends to do those things for you. It's illegal. It's considered murder. So if you get sick enough and you can't do it, then it's terribly, terribly cruel to expect people to stay that way. Others would say, I'll go forever. I will wait for a cure. It will come. And that's fine. That's theirs. But yeah, lots of people I think are not taken care of in that way. And it's like the mobility aid thing. You're sitting there saying, I can't get to the toilet. And if you had anyone who was over 65 saying that, they'd be like, you need to be in a home, we have to get you into care, blah, blah, blah. Because you're not aged, you're not recognised as even being sick. And it's really, really weird to me. I think lack of compassion and understanding, and even because of that, you feel like you're believed and they think you're lying. So this is human dignity and human rights, and the profession that's there to help us, that should be saying, like, we've got these tools, are just going, okay, that's perfectly acceptable. That's partly because systems exist. There's not enough of us to make that big enough a deal, you know, but it's unconscionable. And a country as wealthy and as educated and as privileged as this, we shouldn't be having this problem.
Yeah. Well, Bronwyn, there's 6,500 Australians living with severe and very severe ME, and that's too many to not have any support. And there's probably plenty more who aren't diagnosed or lucky enough to get a diagnosis. So I think one of the main issues is that it's a condition that does not fit neatly into a medical model. And there's still a lot of contentious issues about diagnosis and what it is and how to go about it. And that's just all hot air that is not helpful to you who need the help the most. So thank you. I hope
I also
you're
don't worry,
okay.
I cry really easily. I'm absolutely okay. It's late in the day. I didn't have enough sugar.
I know.
I had my flu jab yesterday too, and it's all a bit much. I also want to say about the emotions. What I found is that my line is so much thinner. I go from being perfectly okay to suddenly out of any energy and frustrated, just like that. And I'm too tired, so I can't regulate the emotions, so I get really angry and yelly. I used to think that I was really good at managing that, but what actually happened is I just eliminated all those things from my life. So when they do occasionally happen, now I'm taken by quite a bit of surprise at how frustrated I get, how quickly I lose my patience, and how little actual skill I have left. It's more that I've just said no to all of those things, and if I've had a bad experience, I just go, well, how do I stop that from happening again? And yeah, I also don't have a family that has a lot of drama, so I'm quite lucky that way. We're very much pragmatic, and we just get on with it.
Thank you. Thanks, Bronwyn. Did you want to say something, Jared?
No, Nicole, sorry, I think that's just me being technologically challenged.
Oh, that's all right.
I thought Carla was going to say something earlier. Did you have something you wanted to say, Carla?
But her hand's gone. Yeah.
Yeah, the topic sort of changed, so it's not as relevant, but
that's okay, we can go back.
A friend of mine in the community pointed out that people with ME have brain damage, and that's sort of informed how I relate to people or cope with if there's an argument or a conflict. I sort of have a lot more compassion with accepting that it's happened and moving on, because I know that they don't have full control over it. And obviously, once you're aware, you have responsibility to try and mitigate it. But it's such a common symptom, or, you know, damage to our bodies, that it is something that I do have a lot of compassion for everyone in our community now.
Yeah. Thank you. Jared, yes?
Now I do. Carla, thank you. What I was going to say was that my doctor, actually, my GP actually says that she thinks of me as having a brain injury. And I have a family member that does have an ABI, and the similarities are incredible. It's given me a lot more scope for what they are going through. But I certainly can't believe the similarities between what I have and what they have. So, yeah, I think it's a very valid point.
So maybe that could help direct therapists as well to, you know, take a cognitive strategy approach similar to people with ABIs as other options. I know occupational therapists, if I blow my own horn, are really skilled at doing that too, to help. As it's 4:30 or 5:30, that's confusing. I know that's the time we've been talking. I just wondered how everyone was feeling about continuing on, whether there were any other things that they wanted to mention before we possibly, you want to talk about the NDIS? Sandra? I can't hear you.
I was forgetting that little mute button. I just, one thing too, everyone's talking about, there seems to be a really big gap between medical research, what discussions on our support groups, and what doctors and practitioners understand. I don't know how that's bridged. We seem to have to take information to sessions, and it's not fair on us. We can hardly string a sentence together, let alone try and explain some research that we found that we think might help us. So I don't know what can be done about that.
It's a role reversal, isn't it?
Yeah,
almost.
Yeah, we've had to become our own experts, and even been blamed for doing that.
You can't win.
Anyway, for NDIS, God love you, anyone who's managed to get on it. I've actually been trying to compile and get things together for several years now. My cognitive dysfunction stops me, and the emotional aspect of going over all the things that are wrong triggers me. So it fries me, and then I get so much done and I can't do the next step, and then by the time I go back to it, I've forgotten what I did the first time. And then my computer breaks down, and this has gone on for several years. I've rang a local LAC recently. I'm just starting to learn their lingo, and I said to her, look, I'm too sick to be rejected. I can't keep coming back to you. What do I need to give you to get in? And she actually was quite open to that, and she gave me a bit of a list of what I needed to do, and probably today answers a bit of it, because I need to find ME educated, experienced people that can assess me and write the right reports I need. And I can't find that basically where I am. I don't know what to do about that, and I'm stuck, and I'm really getting desperate in need for extra support. Because I've had elderly people, friends that have driven me places to appointments and such, and they're sick now and they're not driving. One's in a nursing home. I don't have the support, so I'm really getting quite isolated. My money's running out, and I bloody well need it. So the doctor doesn't know how to write the report. She's been turned back from other things, and there's, her heart probably is not in it because it's just too hard. So really stuck. Really need everyone to hear that out there in the medical world, that we need that help. We need you to
Yep.
do the work. It's not our job.
All right.
you.
Can anyone else help Sandra?
Yes,
Carla.
I really want to say something.
Yes, go.
I was in a very similar situation to you, Sandra. I spent 4 years trying to write my NDIS application, and the cognitive impairment it was so difficult. And, I had this idea of getting a perfect application in and they'd approve me first time. What happened was they declined me. I had to go all the way to the AAT. I was approved the week before Christmas last year, and I still haven't had a planning meeting. So what my point is don't spend the process has changed now, but I wouldn't wait. I'd just get in what you can and go through the appeals process, because currently they're basically making everyone go to the AAT. So I'd just get in as soon as possible. And what I did want to say to any practitioners watching is that this isn't something which choosing to do or wanting to make your life difficult. The wording is so important, and to get annoyed with us or to say, no, I refuse to write reports, it just makes our lives harder. That also goes for DSP and insurance claims as well. But the wording is so important, and just please try and educate yourself. Like, I know there's some GP and other practitioner education programs out there, and it's just all about wording. But as my experience is, you can think you still have the perfect wording and still have to go through the appeals process. So yeah, just get it in as soon as you can and be prepared for a long process.
Okay, Chris, did you want to say something? Oh, can't hear you.
Yes, sorry, I was
That's
muted.
okay.
Yeah, I thought that was a really good point, and I kind of feel like if, with the ME associations and so on, if there's one of the best things that people could do would be to have some people who know and understand ME, who can be health system and disability system navigators for us, who can bring the expertise to help us to understand and translate what we're going through, particularly when we're really struggling. I think that would be, one of the best services that could be out there, because everything I've heard from everyone is when you need the help the most, you're least able to deal with the system. It's just so hard there. So yeah, that would be a fantastic thing that they could do with us. And I guess just my other sort of closing comment was, I just wanted to say thank you for everyone for making the effort and coming along and sharing your experiences with us. There've been a few times through this today where I've been moved to tears hearing your stories, and I really sympathise and really appreciate for what you've gone through. And I think what you're giving back now to the community by sharing this is really, really important. And if the work that we do can stop other people having to experience some of the stories like Mim and Carla and Bronwyn have told us, of going through and being told the wrong thing and being made incredibly worse, that is a really important change for people. So thank you very much.
Yeah, thank you, Chris. Thank you. Jared or Bronwyn? Yeah.
Yeah, sorry. Just with the NDIS, that for me was a 19-month process. I was rejected, firstly. Then I went to a review. I found out that all the review does is actually review the person that did the initial knockback. When I put the application in, I was told, that an LAC would be able to help. My LAC said, oh, sorry, I can't help you with that. They don't like to pay for that. I thought that was pretty good straight off the point. And then I went to the AAT, We had 2 hearings, and just before the 3rd one, they did approve me. I have a very small package, which I'm very grateful to have, and it absolutely helps. But it was a very demoralizing process. I actually had to, I was at my wit's end. I engaged with a psychologist to actually help me through it. It essentially made me feel worthless and dishonest, that they were telling me, their whole thing is that I hadn't done every form of treatment that was available. I explained there wasn't any. I actually offered to pay the people. I said, you get me a treatment that'll fix me, I will pay you. How much do you want? But of course they're just reading off a sheet of paper, basically. It is the most ridiculous process. And then the very end of it was an OT was sent to observe me. That was, I know you're an OT, Nicole, but that was actually really confronting, because I did everything perfectly when she was in my house, except that's not what she reported. And she actually picked up on things that I did that I didn't realize how bad I was. I picked up on a couple of cognitive mistakes. She picked up on a whole lot. And to actually read a report that then shows you how bad you really are when you think you're probably going okay was very confronting and very difficult. The second OT I got came up with all the same things independently. So, but then to go through the NDIS process and with that OT report, and then essentially they are backing back from that. So half an hour of gardening a month, things like that, that are just, like I say, I'm very glad to have them. But it is a process that all I would say to people is, if you're going to go through it, have a really good support network behind you, because it will, and even if that's just people online, like it will just, it could destroy you when we're already vulnerable. That's all.
Yeah. Bronwyn or Min?
I was quite lucky with NDIS. I just got asked for more information once. I had a friend who was going through it at the same time, who was getting held up on GET and CBT, and I was well enough, I mean that's proportional, to get assessed for CBT and told no, you don't need it. And I was well enough to do GET with my physiotherapist, who was very understanding of my limitations. It set me back, but not very far. And I got in, but that was 3 years ago. And what I will say is it's absolutely worth it if you can allow it not to chew away at both your physical and your mental health. And I'm quite lucky in that I'm able to sit there and go, it's a system, it doesn't know me, I know I'm not lying, I'm very ill, I agree, I need help. So whatever it throws at me, I'll just keep going. And what I would say is, in Carla's experience as an example, but also the online nationwide community, most people who persevere to AAT, who are unwell enough to need home help, those who are housebound basically, do get on. And yes, it's really demoralising, and it feels like they're telling you you're a liar, but they don't know you at all, and the people who are assessing you don't know anything about our illness. So I think it's more of a marathon, and if you know that that's how the system works, you can possibly take the personal element of feeling persecuted by these people out of it, because they are literally just doing a 9-to-5 black and white job. It shouldn't be that way. I don't agree with it. It's horrible. But if you need the help, I would encourage people to not let the system stop you, but also try and let it affect you as little as possible, because these things take at least a year of energy, and I think AAT at the moment is typically taking 9-12 months. So it is this long haul if you just pace yourself, get one thing at a time. And the most important thing is that your GP says you need help with stuff to do with daily living activities. An OT report is amazing, but if you can't afford it, they will usually provide you one at the AAT. They're the things that get you in. They can be very expensive. and they typically want a specialist of some kind saying with the diagnosis, and yes, I agree, there's no other treatments to try, and that can be almost any type of specialist that's related to ME/CFS.
Thank you. Thanks, Bronwyn. Do you want to add something, Mem?
Yes, just quickly. So firstly, access to Medicare is extremely difficult or impossible for frail homebound and bedbound people. So something needs to change there with Medicare, because you cannot access a GP bulk bill unless you turn up there once every 12 months, which many people with severe ME cannot do. And then with NDIS, which was an utterly dehumanising process, which fortunately I have access now and it has been life-changing, but the process was agonising. In order to go through that process, people first need economic stability. They need somewhere safe to live, and they need carers. Like, there's no way I could have gone through that process unless my family was supporting me 7 days a week around the clock, providing me with, emotional support and financial support. And that freed up my ability to research this and pursue the NDIS. So I think it's really complicated, and I don't know how people are managing who don't have those foundational supports in place, especially with the housing crisis.
Yeah, that's a good point. Thanks, Mim. Carla, did you want to add something?
Yeah, I forgot to say with NDIS, the focus is on impairments, not diagnosis. So going through the ICC or the CCC and listing each of the symptoms that are impairments that are relevant to you. And then you have to say the treatments you've done against each of the impairments. You can't just say in general the treatments that you've done. And the issue with my application was they wanted the actual reports from when I'd done GET and CBT, but because there'd been like 7 years prior or something, they weren't on anyone's system anymore. So although we all know that GET and CBT are harmful, the government agencies are still requiring them. So you've got to address them in some capacity.
Yeah. Yes, they're still part of the Australian clinical guidelines, aren't they, for ME as a treatment? Yeah, first line of defence. Yeah, I get that. Does anyone else have anything else that they would like to talk about? If not, maybe we should think about wrapping up for this evening. How do you feel? Is there something else anyone would like to contribute? No? Well, thank you so much for participating this afternoon and sharing your knowledge and first-hand experience, because without that, there would be no us, and we would not be able to help in any way or know how to help. So thank you for your time, and I really hope that you don't crash anytime soon.
Thank you.
Thanks.
Bye.